Welcome back to another episode of The Art of Volunteering. I'm your host, Stormy Bell. We are almost halfway through the season, and I cannot believe how many incredible guests that we've had on the podcast. And today's conversation is just one I know you're going to enjoy. So welcome, Milena. Milena is the executive director for Maternal and Child Health Consortium. She's been in the human service field for over 26 years. Before she became the executive director, she was spearheading a large countywide effort researching best practices in evidence-based strategies around trauma-informed care and resilience by study of the Adverse Childhood Experiences, or ACE, at the Home of the Sparrow, while serving as a board member of a Maternal Child Health Consortium. She joined the Maternal Child Health Consortium in 2004, overseeing the Healthy Start program. She obtained her bachelor's in business administration and studied for a master's in public health. She is a certified mental health first aid instructor. I love that. Like, there's just so much right in there that we just have to dig into. But we're going to start with Maternal and Child Health Consortium. What is your mission and what do you do to achieve your vision?
So Maternal and Child Health Consortium, we've been around since 1991. And the organization was created to ensure that women and children have access to healthcare. And so since then, we have 3 core programs. And so our main service is home visiting services. And we use a evidence-based curriculum called Parents as Teachers. And we start all the way from pregnancy to when the child is ready to start kindergarten. So we provide all the education and support that pregnant moms need in order to deliver a healthy baby, including the access to healthcare, including that they are enrolled in the WIC program and that they do have health insurance. If they're not eligible to apply for health insurance, we also make sure that we connect them to any other health centers or the health department to ensure that they deliver a healthy baby. And then we work with the mom, the baby, and the child, and maybe any other family member in the household to ensure that they receive anything that they need, different resources, or we develop goal plans with the families. We have, within the 3 core programs, we have the family benefits program, and we have a specialist, and they conduct health insurance applications as well as SNAP applications. And then they also follow up with these applications just to ensure that the individual is approved and have access to healthcare. The majority of the individuals that we serve are children or minors, which is basically our mission. We serve parents with young children, which is also my passion, just to share. And then we have a 3rd core program, which is the Family Center. Is located in South Chester County. So we provide services to parents that have children, again, from 0 to 5-year-old. And we have bilingual, bicultural parent educators, and they provide home visiting services. And basically every time they conduct a home visit, they have to cover a specific educational session with the family, as well as doing educational activities, physical activities with the child. And so it's a great support that the parents receive from MCHC, the Family Center program. And then under that program, we have a fatherhood program, and we also run an annual kindergarten transition program. And we do this in collaboration with the school district. And really, it's mainly for children that has never been exposed to any preschool setting, and maybe they have been the first years of life just at home and not really interacting with other children, or even have the idea what to expect, how school is going to look like. And so we do even simulate a regular school day where we provide transportation, we provide the buses, and also the intervention that the parents need and education that the parents need in order for them to know what to expect once the child is ready to start kindergarten, and how they can actually be involved.
Wow, that's a lot.
Yeah.
So, how do families find out about you?
So the main source is really word of mouth. We have um, community members that maybe the neighbor uh, told about Maternal Child Health Consortium. We do have a family center located in Chester County. As I mentioned, we do serve that area. We also have an office in Coatesville, and then our main office is in Westchester. And so we also co-locate at the local libraries in Phoenixville, Pottstown, and also Career Link. We work in collaboration with United Way of Chester County to be able to have our staff members providing services there. I mentioned libraries, so that would be like, for example, Westchester in the borough, because we know transportation is a barrier. So many families cannot really drive and get to other maybe locations where they need help, either with home visiting or even in-kind donations, right? Like, for example, we provide support to families, not only with food boxes, but also like diapers and infant items as well as needed, of course. And so that model has really been very successful for many, many years, because we know that that's the best way to really meet the families where they are and provide what they need.
That's that's really cool. Talk to me a little bit more about the wraparound program, the like going into kindergarten. Why is that important?
So it is important because, as I mentioned, so we do serve anyone, right? If we have families that they speak the language, they speak English, but then also families that they may only speak Spanish, or maybe now we're seeing a different dialect that we even need interpretation services. And so the language barrier and also the cultural barrier, right? They have different culture. Um, Particularly in Chester County, where we run the kindergarten transition program, families, they don't really know how to navigate the school system, even to enroll their children, or maybe to like knowing, yes, my child needs to go to school, right? I have to do that. So we have the parent educators, and they really gain all the trust from these families, and we're the voice, particularly the voice for the children, to make sure that they understand what they need to do, how to understand the school system, how they need to respond, how it's so important, for parents to be involved. And if they have questions, then they can reach out to the school. Um, in our countries, we see that the system is very different. And
Okay.
so, and of course, we have families, as I mentioned, coming from different other countries, and the law in different countries is different. And when they come here, they really need that type of intervention and education to ensure that they know how they can be involved in and also basically to ensure that the children are successful once they start school. That's critical, and it's actually part of my own passion, right? Children is because that's our future. Children are our future, and we know that we need to guide them and help them. And education is the number one need for children, right? That, and hopefully we will see a difference in the future.
You actually said what I was thinking about having these children have the setting them up for success, and having that first kindergarten year sets their whole trajectory for school. How they feel, how they're being understood, or how they're understanding the teacher, the kids in the classroom. How navigating that is so important. And if you're not coming from a place of experience, it can be overwhelming. So I can just really appreciate the work that you're doing.
Thank you.
All right. This is the art of volunteering. So, do you have volunteers that work with you? And if so, how do they fit into your delivery model?
Yes, so it's a great question. So we at MCHC, we do have different levels of volunteers. The first one is, as I mentioned, we provide services to pregnant moms. And because we do visit moms during pregnancy, and then we continue providing services once the baby is born. When the baby is born, we have our community health workers, they come home, meet the baby, and then they also bring a baby bundle. As we receive in-kind donations as a nonprofit organization, we have like diapers, we have like items for the baby, we have clothes, and so we receive a lot of support from group of volunteers or maybe individual volunteers that they come on a monthly basis to our office, particularly our main office, and they assemble the baby bundles. And so baby bundles is really like a gift, right? Like when you go to a baby shower and you have a bag with diapers and baby items and wipes. And so that's a great support. And basically, we assemble about 20, 25 baby bundles on a monthly basis. And so we have ongoing volunteers, again, coming from different either corporations, community individuals that they feel the passion, right, of our mission. And then also under the family benefits program, we do we run an annual campaign, the back to school campaign. And with the back to school campaign, we collect back to school items, and then we assemble the backpacks, and we distribute over 600 backpacks every year to children that perhaps their parents cannot afford to really purchase all the items. But also, as part of that campaign, which is of course aligned with our mission, is that we want to make sure that the child is up to date with all immunizations. So we do provide the education to the parents. Also dental care, very important, the checkups, as well as if needed, right? Maybe the family might need a SNAP benefits or maybe reduced lunch as well, as we facilitate the service of submitting applications to the Chester County Assistance Office. And so we ensure that they are fully equipped, not only with the back to school items, but also, with making sure that they have access to healthcare so that they can actually focus on school and go to school and not feel like hungry, right? And or that they need any other type of medical care so that they can focus on their educational aspect of it. So we do receive a lot of support from volunteers, because not only assembling the back to school or the backpacks with all the back to school items, but also we do go to different health fairs. We actually have over 20 different locations around Chester County that are collecting items for MCHC. And so the volunteers, they help us to collect those items. They help us to actually, before the back to school campaign starts, to be able to generate and create like flyers and the need. And also they support us by calling the different donors, sometimes banks. We have schools, daycares, different entities that actually they place a back to school basket for MCHC. And of course, I didn't mention libraries. We do collaborate with libraries. And so they collect the baby items and I'm sorry, the back to school items, and the volunteers provide a lot of support, as well as to keep the inventory once we collect all the items.
So is that like 50 volunteers, 100 volunteers? What's that?
So Maternal Child Consortium, we have about like 50 volunteers every year. We have different seasons where some of the volunteers, they actually come back. That will be maybe having moms and their children. We have specific groups like Girl Scouts, Boy Scouts. We do have groups from different corporations. Like, for example, this week we had Enterprise, the corporation who sent like 15 members to help us to reorganize the in-kind donations and our local storage, as we also receive car seats and brand new car seats. And so we have to make sure that we keep the inventory up to date, as well as it is well organized. So I will say it's a variety of different groups or maybe individuals who provide a lot of support or volunteer hours to MCAC. I also want to mention we actually collaborate with Devon Prep High School, where they send every year in May two of their students, and they actually learn a lot, not only about, as I described, not only helping with in-kind donations, but also learning about the type of service, the different services that we provide, and also having that direct interaction and understanding the nonprofit world and how important it is to really contribute back within the community.
That's awesome. From your volunteers and from the work that you do, can you share a story of impact, something where you have seen the work that you do to making a huge difference in someone's life?
Yes, I can share even our board members. I think that's is critical, just to always acknowledge their support. I mentioned so because our main source of services are like the home visiting type of service, and so when we have a board member joining and also providing, right, allocating their time or spending their time providing support with MCAC, they also are part, or they have shadow home visits, right? And so one time we had a board member, and she actually, of course, we call them participants instead of clients. So the participant, she actually was willing and authorized us to bring another member, right, to the home visit besides the community health worker. And so we had the board member, and she actually really joined and or I would say enjoy the visit and learn about the participant, and was able to really experience the need and how grateful the participant was. And as part of the visit, they noticed that the participant was really in need, and even like she needed baby items, right? Like she needed like a bassinet, a stroller. She was mainly by herself at home because the father of the baby was working, long hours. And so we usually, as I mentioned, provide the in-kind donations as we receive donations, but maybe the bassinets, or we do have car seats, but not like strollers and other large items. If we don't have them, it might take a little bit longer for us to be able to find maybe a donor that can actually provide that type of support to the family. And so our board member, she was in that position right there, and she said, I'm just gonna donate a brand new stroller for the mom to be able to, the baby was like 5 days old, and she was mainly isolated at home. And again, like we always check, do they have food in the house, do they have everything they need? Safety is critical as well for us. So, and that was part of, like, at the time, for the mom to be able to have a stroller and also even go out of the house and enjoy the weather. Part of what we say, it's great for you to go out with your baby if you can, even if they don't have transportation, right? If they have a specific maybe a local park where they can walk around. And so that was a great impact. Participant had no words to really thank our board member to be able to provide that donation to the participant. She did receive we actually received the stroller after 5 days, and then our community health worker was able to deliver the stroller. And again, this is just like one story out of many. And yes, I can tell you that was a great story, I will say, that shows the support, right? That part of the support that we provide to the families and the moms and the babies.
For that, when you're talking about impact, that was impacted two different ways. The mom and the baby were impacted by the generosity and the mobility of being able to get out, but that board member truly got to understand your mission and becoming a major advocate for who you are and what you do. Oh, that's incredible.
Yes, and communicated that to other board members as well, which they're amazing. They really provide a lot of support to MCC in different capacities, not only as, of course, as the legal entity, right, of the organization, but but or having legal responsibility as members, but also, you know, in the role of volunteers as well. It's incredible because they feel the mission, they support the mission, they can you know, that's a way as well to support our staff members as they go out and meet the families, right? And so it's really impactful for everyone, as you're saying, for the staff, for the participants, and
For
for the
everyone.
board.
Makes you feel good when you hear that. That's happening and it's in place.
Yes.
All right, let's pivot a little bit. You have a volunteer journey, and you've kind of, I've read a little bit about what that looks like. It's pretty darn cool. So I want you to share about it, and I don't want you to be humble. I want you just to be like, this is what I've done, because you've done some cool things. So
Yes.
go for it. Talk to me about your journey.
Well, I will say at a personal level, right? So to tell you more, I know you mentioned, right, my background is business administration. I actually, like, I never, ever thought that I was going to be involved in the nonprofit world. I've been here for a little bit more of 25 years. And so I actually started in a nonprofit organization located in Philadelphia. And I started more like putting together numbers and budgets for proposals. Like, it was more, and then operations, and then little by little. And then I got the opportunity to provide education on domestic violence, and started getting and training myself and getting into the nonprofit world. Until then, I got the opportunity 20 years ago to start working with MCAC, Maternal and Child Health Consortium, overseeing one of our home visiting programs. And so little by little, I started getting more involved and more involved. And of course, one of my passions in life really is like, how can we help others, in this case, other nonprofit organizations, to succeed? And so back in 2010, 2011, actually, Maternal and Child Health Consortium applied for the first time to be accredited by an organization. It's a statewide organization called Pennsylvania Nonprofit Association. And the whole accreditation process takes over a year, really, because it looks at everything, right? The finances, the human resources, the development component, the whole organization, right? Of course, the legal aspect of it, you know, are we compliant or not? And when I started receiving the training from the organization and looking at the different requirements and why it's so important as well for a nonprofit to be able to make a difference, I said, oh, I would love one day to be part of that organization, right? Or at least get closer. And so we had that, but then back in 2019, I was invited to actually join a committee, right? Of course, as a volunteer, join a committee that they have, and it's called the Standards for Excellence. And the Standards for Excellence is really the committee that work with the nonprofit organizations to be able to provide that type of support they need if they want to receive the accreditation. Accreditation is so important because you, as a nonprofit, if you have, you know, if you're in compliance, then of course you can also engage more with your funders as well as the board members to be able to say your support really makes a difference, right? And so I had the opportunity to even became a chair of the Standards for Excellence, really understanding deeply how the accreditation process works, and as well doing it even as a member organization from MCAC. We have been going through the reaccreditation process 3 more times, right? Because it's every 4 years, and I've been involved with that process. And so, but also like the satisfaction of dedicating your own time, Saturdays, Sundays, to be able to review applications, provide feedback to these nonprofits, and provide support to other leaders who I also identify myself, right? Because we are their peers, of course, and just see how we can really provide that support so that they can run and be successful with their own missions, right? And so that's one of my passions, right? And so I've been since 2019, I continue dedicating my time being that committee, but also I was invited to join the board. And so since 2020, I've been joining the board, usually again after hours. It's like just you dedicate hours, you dedicate your time. There is a lot of support as well as growing and learning with other leaders from other nonprofit organizations. And again, learning more about the different trends and good practice, right? And how can we support even more and more. So that's one part of time that I like to, as a volunteer, I dedicate myself. I also serve on another board of a local organization, and that was more like a structure based on this position that I currently have at MCAC. It is for the Coatesville Center for Community Health, where they have the different executive directors and now other board members that provide support to the center. So with that center, we actually, as we say, not only dedicate your time as a board member, but also providing volunteer hours, right, to provide support to this organization. So in that, not only serving as a board member for the Coatesville Center for Community Health, but also being involved in community and health fairs, right? They do have like a women's wellness event every year. I like to attend to that. Also, of course, interagency meetings and providing support to their executive director as well, and bringing more, opportunities for not only the center, but also the community and the organizations that are part of that center. So that's also another part of my passion, like when you're really making a difference. And then at the personal level, I believe I mentioned, so I do, I'm a volunteer of my parish, actually located in Paoli, and I'm a minister. So I've been providing, I will say since 2014, providing hours and help, of course, with different activities at church. And I also, again, it's really the community, the families, the all the needs that we see, and then dedicating, weekends to know, and learn more about how can we actually support and respond to the needs within our county, Chester County.
That's awesome. Thank you for sharing. Two things. One, I wanted to comment about that because, where is it? You had made a comment when we were preparing, and it fits with what my mission is with this podcast. You said, through dedication and commitment, I believe volunteering helps build a stronger, more compassionate community. I wholeheartedly agree with that. My vision for what this podcast does is to help restore the fabric of our society. And when people give of themselves, helping the soup kitchen, being a board member, aligning your passions with purpose, it only helps restore the humanity that we all need to have. So I so appreciate that. Like, I wholeheartedly agree.
Yes.
All right. My other statement was that in 60 seconds or less, why do you volunteer? You do a lot and I love it, but why do you volunteer?
To make a difference. Short, very short, but to make a difference and also fulfill myself. I know that when we know that we're making a positive impact, not only in my daily regular role as an executive director, but also, when I'm out there, like dedicating hours to maybe help other organizations or even community events and learning more about what is happening, just to know that we're helping others. And also I'm really, really big and I'm passionate about working, like the collaboration is big, because we have our mission towards children, but one of the things that we also make sure as an organization, and it's really an expectation starting from myself, is that we don't turn anyone away. If we have even maybe a senior who is in need, and it could be food, it could be health insurance, and not understanding the system, or making a difference, for example, with even providers, right? Like we do work with the local hospitals, with the health centers, and again, other nonprofit organizations. And we need each other to really move the needle. We need each other. So that's one of the things that actually I ensure that all of our staff members, we start there, that it's not only us, it's really we need to collaborate. And I will say, even since the pandemic, that Chester County now, it's really, I see an integration of services, including working with Chester County, right, and the county and other organizations. So it's good to know that, and really that's a fulfillment. Like that's something. When I discovered the nonprofit world, as I mentioned, it's not about only numbers and admin. Is really making an impact and a big difference with families and children. That's my passion, so it really makes a difference.
Awesome. Okay. You have seen a lot. You've done a lot with volunteering and with Maternal, Child, and Health Consortium. Can you share a blooper? It doesn't mean something went wrong. It just didn't go as planned. And what was the lesson that was learned from the experience?
Well, I will say, in terms of like, if continuing with the having volunteers, for example, usually we always want to be ready when we have mainly like groups of volunteers, right? And many times we do have deadlines. So just to share with you, a story. One time we had to actually move all of our in-kind donations from one storage to another. And that includes like a large number of car seats, because we do receive every year a large number of brand new car seats. And of course, for us, it's not only giving out the car seats, we have to provide the education, ensuring that they are correctly installed, right, for safety as well. So it's a process. And so one time we had we were waiting for a group of volunteers that will help us actually to take all the items from one storage to another. And we were not able to, after a few hours, we still needed to do 2 more trips, and it didn't go as we had it, as planned. I remember that day even started raining, and then we had the staff members, and I can tell you, like, just number one, with the passion that our staff members have, is like, it's okay, no worries, we'll get it done. Volunteers, they needed actually to leave almost at the end of the day. And then we had to backup plan, like, take our cars, finish these, stay a little bit longer, and also make decisions right away. So for us was like, okay, let's see who else we can actually, contact and call and finish these, because we had the deadline to have the other storage completely empty by the end of the day. So, it was something that it wasn't planned the way how usually we, projects like that, if we have, a number of 15, 20 volunteers, like in 2 or 3 hours, a project like that would be perfectly fine, right? Like, go smoothly. But then unexpected situations, right? Maybe instead of, I can't remember, I think we had five members that couldn't come at the end. And so it's like, you just have to plan ahead of time, and right there, make decisions and make it happen. But again, it's because of the support and also the passion of other staff members. It's like, okay, we have to just think quickly and get it done.
And get it done.
Yes, exactly.
Sounds like always have a plan B.
Yes, exactly.
All right, Milena, we are actually almost at the end of our conversation, and it has been wonderful.
Thank you.
I'm going to give you the mic. I want you to love on Maternal and Child Health Consortium, or one of the other nonprofits or organizations that you work with. Maybe there's something that we didn't cover in our conversation, or just why people should check you out or get involved. Whatever, go for it.
I will say, with Maternal and Child Health Consortium, just learning more about our services Even though, as I mentioned in the beginning, we've been around since 1991, believe it or not, there are community members that they don't know exactly what we do and the impact that we do in Chester County. But also, I want to take the opportunity to say the other nonprofit, the Pennsylvania Nonprofit Association, is the same. Like, there is a lot of support for nonprofits, and I will really encourage everyone to just look at the organization and look at what we offer, and all the support that actually nonprofits can actually receive to be able to make an impact in their own communities around Pennsylvania.
Well, thank you so much. I hope you enjoyed this conversation as much as I did.
Thank you, and thank you so much for having me.
You're welcome. It's been it's taken us a couple weeks to get the time scheduled, and I'm so glad that we did.
Thank you. Thank you again.
All right, to my listeners, thank you so much for tuning in today. I hope you found value in today's conversation as much as I did. And if you did, I'd like you to go wherever you're listening to this podcast and rate and review it. It really does help other people have an opportunity to learn about these men and women and volunteers are doing in your own community or around the world. To see our vision of restoring the fabric of our society. Thank you and have a great day. Bye-bye.